I want to begin tonight at 5 with this COVID milestone across the state. Indiana now has 1 million positive cases since the beginning of this pandemic. Now, despite this large number, we're seeing cases trend downward across Indiana. In fact, for weeks, we've seen this steady decline in hospitalizations, positivity rate, and the overall case numbers. And today, the state of Indiana reported 701 more positive tests. One person died, but nearly 9,000 more Hoosiers were fully vaccinated. Now, here in Marion County, the 7-day average positivity rate has dropped steadily over the past month. Now it's just over 7%. The Marion County Public Health Department wants more Hoosiers living and working in at-risk situations to get tested for COVID. Tonight at 5, our Rich Nye explains how you can get free, do-it-yourself COVID test kits.
This is the Marion County Public Health Department COVID-19 testing site. It's a drive-through. Right now there's no wait, but you do have to come here. But for many in Marion County, now the test can come right to your home. The health department is offering a 1-month supply of the QuickView Rapid COVID test to Indy residents who live in zip codes with high rates of COVID cases, lower vaccination rates, and high numbers of essential workers.
To have the ability to test yourself in the privacy of your home, the convenience related to it, and you can get the results in 10 minutes, phenomenal.
Maggie Hoyt is looking forward to a trip to a resort in Mexico. She feels fine but got tested Monday to make sure she doesn't take the virus with her.
It's just important if you are exposed to not spread it to others and to know your health status, and then you can inform others too if you do end up being positive.
The free COVID test kits can be shipped right to your home by filling out an online form, or you can pick them up at 5 health department locations. Jerry Long is interested. She suffers from allergies and has a sinus infection. She got tested to make sure it's not COVID.
My symptoms are the same as the COVID. 20 years, I know, but yeah, just to be safe, if I felt like I had been exposed or been out somewhere, then I could do it myself.
The Say Yes COVID test program hopes to reach 125,000 people in Marion County.
Now, the health department encourages anyone who lives or works in a high-risk area to take that testing challenge for a month, testing twice a week, regardless of any symptoms. Doctors right now are warning against complacency as we see these new infections decline. They stress this even more with the upcoming holidays.
It's so important to get vaccinated for the good of the community to keep the level of infection down. When you do that, there's no reason at all why you can't enjoy the holidays.
Now, according to the CDC, only 1 in 26,000 fully vaccinated Americans has died from COVID. The risk of dying from COVID is 11 times higher for unvaccinated adults. Our Verified team is getting lots of questions right now about these booster shots we've been talking about as they become more available. So tonight at 5, they're taking a look at when you should get antibody tests and booster shots.
Antibody tests were popular at the start of the pandemic, and they're popping up again with talk of booster shots. Nalda asking the Verified team if a COVID-19 antibody test can check immunity after getting the vaccine, informing whether someone should get a booster shot. Let's verify. Our sources are the CDC, the FDA, and Dr. Jane Morgan, head of the COVID task force at Piedmont Healthcare. A reminder, antibody tests look for antibodies in your blood that fight the COVID-19 virus, but the CDC and the FDA both say you should not use this test to check immunity after getting the vaccine. The CDC lays out several reasons. Antibody tests can have varying levels of sensitivity, and some only detect antibodies from a natural infection from COVID. They would not register if you've been vaccinated. Bottom line, even if your antibody test comes back positive, showing some defense against the virus, scientists are still trying to figure out what that means for immunity. Right now, there's no magic number or threshold correlating protection.
What we don't know and what we don't have any published studies to show is what is the level of antibodies needed that actually confers immunity.
Dr. Morgan says immunity is also more complex than just antibodies. Cellular immune response also plays a role, and antibody testing does not check for that.
These vaccines work not only by antibodies, but by cell-mediated immunity. So these B cells and T cells, that's also incredibly important. So it's multi-layered. And so because of that, we are advising that we not use these tests as guides nor more as indicators of what your immunity status could be.
So public health experts say no, antibody testing is not recommended to check immunity after getting the vaccine. Experts are still figuring out how antibody results relate to your level of protection. They instead advise following public health guidance when deciding whether you need a booster shot.
And if you've got something you'd like us to verify, just go ahead and send us an email at verify@wthr.com.